Multisystemic inflammatory syndrome in children, that's MIS-C, by case definition is any person who is less than 21 years of age, has fever for more than 24 hours, ill appearing, needing hospitalization, who has evidence of elevated inflammation or inflammatory markers, and has 2 or more system or organ involved, without any plausible or alternative diagnosis to these findings. In the setting of recent novel coronavirus infection, which could be just PCR or antibody, or you may just have no PCR or antibody positive, but has evidence of epidemiological contact, direct contact with person who have had this infection, then that meets the criteria for MIS-C. The most common presentation is fever we talk about. Second is tummy symptoms, abdominal pain, vomiting, diarrhea have been more common. Then they would notice some rash, any kind of rash, pink, red eyes, changes in the lips and oral cavity, extremity changes, and they may be very lethargic and tired, in some cases being delirious. So these have been the most common presentation so far. So what I would ask for the parents is basically, if you have a child with fever, the child may or may not have the rash, but if they have the abdominal symptoms or you're noticing anything else like we discussed, call your primary doctor, call your child's primary doctor. If we pick up early, we treat them before they end up having multiple complications. So we want to pick them early and treat them early so that they do not need to be in the intensive care or need heart-lung machine and multiple drips, which ends up having multiple complications, right? So we would try our best that's where we want to be alert. And yes, this condition is still very rare. And when your child has a fever for 24 hours doesn't mean that your child has a MIS-C. And your primary doctor would assess and basically have a low threshold to talk to your doctor rather than having the high threshold. Be aware but not panic.